Hi, I'm Hani Shamat. I'm a senior program coordinator at the Shared Usability Center. And today we are talking with Suzanne Kalmbacher from Cecil County, Maryland, about updates to the Compass program. Compass was originally developed and implemented with funding and technical assistance provided by the Federal Transit Administration's Integrated Mobility Innovation, or IMI, program. The IMI grant supported Compass as a demonstration project, and Cecil County has been able to continue providing this service past its pilot phase. So Suzanne is here today to talk about how the program has evolved since. So thank you so much for being with us, Suzanne.
Thank you for having me. I appreciate it.
Of course. Just to start off, could you please introduce yourself and Cecil Transit and the Compass program?
Sure. So as you said, my name is Suzanne Kalmbacher. I am the chief here in Cecil County, Maryland of our transit program. I have about 32 years of experience in the passenger transportation industry. And I've been in my current role since 2017. So I've been here as chief of transit since for about 8 years now. Cecil Transit's about 30 years old. It started in 1998 as transportation to and from our Cecil County's two senior centers at the time. So it was basically just a demand response service. And then it wasn't long after that, it launched its very first circulator route that only ran from like 7 a.m. to 12 p.m. But the demand was so high for that little fixed route that it just continued to grow from there. Today, Cecil Transit operates 3 fixed routes in a countywide demand response system, as well as the Compass program, which, as you stated, was founded during the IMI demonstration grant timeframe. And that program serves individuals that are living in recovery houses that are, have some sort of successful recovery history for substance misuse. And we are able to help those individuals get to and from really whatever they need to go to, but focusing mostly on recovery support and employment. But individuals are able to use this service to access anything, whether it's shopping or other medical appointments, daycare if they work and they have children, social interactions, whatever it is that they need. So this program never stopped since its inception, and we're quite proud of being able to sustain it.
Great. And can you talk a little bit about Compass's partners? I mean, who has Cecil Transit partnered with for this program, and how have those partnerships evolved throughout the course of the program?
Sure. So this program actually was born out of a conversation that I had with our software provider at the time, which was Route Match. During that conversation, we kind of knew that IMI was coming, and we talked about different ways that we could use that funding for something innovative in Cecil County. And we originally talked about doing employment transportation. But in those conversations, we both Route Match and Cecil County decided that we wanted to make sure this was transformational in nature, that we really made a difference in the lives of the people that were going to use our service. And that's really when we pivoted to substance misuse recovery, because Cecil County was affected very early on in the opioid epidemic. We're halfway between Philadelphia and Baltimore. And the I-95 corridor runs right through our county, making, that opioid problem exasperated. So when we met with Route Match, we talked about using it for substance misuse, and really we just kind of built that program from there. From there, we added partnerships with other recovery houses in the county. So at the time, there were 6 recovery houses, and we had all of them on board, and we partnered with all of them. We had memorandums of understanding in place with them so that they understood how the program worked. and understood their responsibilities from a house perspective if they participated in the program. We also worked very closely with the Cecil County Health Department, who really had their finger on the pulse of the problem and were really able to help guide the program and tell us like what really was needed. And then the Cecil County Drug Court program actually was a great partner as well, as they really had difficulties getting individuals to and from their drug court assignments. And really all those partnerships still remain. They're still pretty solid.
So you were successful in continuing the Compass program, beyond IMI. Can you talk a little bit about what other sources of funding have supported this service?
Sure, and I actually put down some notes because we actually applied for quite a bit of funding to sustain it. But from a historical perspective, when IMI was only a 12-month demonstration period, and when we saw the huge difference that this was making in people's recovery, we decided that we wanted to sustain it no matter what happened. So the county was committed to kind of funding that if need be. But we were also able, the Maryland Transit Administration is actually our pass through for federal funding. And they were a big part of this project, and they were very supportive of it. And we worked with them to figure out how we could use our traditional transit funds to support the program. So we get state funding through the state for large urban. It's state large urban, is not federal large urban. And because of state funds, we decided to use that. Where federal funds, if we had used our federal 5311 and 5307 funding, we would have to open it up to the general public. We couldn't keep it just for recovery house residents. And honestly, we didn't feel that the program could be maintained at that level. We didn't have enough drivers, we didn't have enough vehicles, or we would have had to shrink the zone to such a tiny zone that it really wouldn't have been effective. So we were able to use that large urban Maryland money in order to sustain it, which we still do today. But in addition to that, we've gotten some funding through the Comprehensive Opioid Stimulant and Substance Use Program, COSUP. So Cecil County gets a portion of that pie and gives it out to programs that support substance misuse and the opioid epidemic, and decided to give us some funding. So they're funding us at about $66,000. And that's a 3-year grant. So we're hoping that continues beyond that. And just this weekend, we found out that we were awarded $100,000 for FY25 from the Opioid Restitution Fund. So that is basically a fund that Cecil County is receiving from the state of Maryland as a result of lawsuits towards the producers of those medications that created the epidemic. So we're really excited about that. That's actually going to help us increase the program a little bit. We're going to be able to go beyond just recovery houses, and we're going to allow individuals that are transitioning into independent living a 6-month time frame to kind of get back on their feet and be able to stay in the program. We're going to add another driver, and we're going to add another municipality to the program in order to kind of like just broaden that scope just a little bit more. So we're very excited about that. But we've applied for grant funding from so many different sources, and unfortunately we weren't successful in a lot of those. A lot of it is looking for brand new programs, and there's, no matter how much we tweak the Compass program, it's still considered an existing program and really wasn't considered a good fit for those grants. But we applied for the MADI program, which is the Mobility Access Transportation Initiative, the Mobility for All grant, the Opioid Crisis Intervention Challenge grant, and an Enhancing Mobility Innovation grant. In addition to that, we just recently got a notification that our letter of intent for a Maryland Rural Transportation Health Initiative grant. has been accepted, and we're allowed to submit the full application, which is due by July 25th, or no, July 11th. Anyway, if successful, that would give us about another $130,000 to this program.
That's fantastic. That's very exciting news.
Thank you.
And so you talked a little bit about how this program has expanded since getting access to these other funds. Have there been other other peer community organizations or other recovery houses or other organizations in the area that are interested in participating or learning more about it?
So there are, I mean, we get a lot of inquiries about this program. And originally there were 6 recovery houses. I think I mentioned that earlier in Cecil County. Several of those houses, for whatever reason, funding issues during the pandemic, really did not, they no longer exist, but new houses have taken their place. And now we're up to 8 recovery houses that we partner with. There are more that are outside our service zone. And of course, all the ones that are outside the service zone, really are interested in participating in the program. It's just the cost of kind of extending into the more rural, very rural areas is just very difficult, because it would take a lot of vehicles, a lot of drivers in order to maintain a reliable transportation option. We also, we've had a lot of for-profit organizations reach out to us, whether it is, medication treatment centers, things like that. The difficulty there is no one really wants to pay for the service, right? They want to be a part of it, but getting people to contribute to it and to support it financially has been a challenge. And I'll probably talk a little bit about that a little bit later on in the interview, but yeah, so we're up to 8 houses and getting inquiries all the time.
That's great. That's fantastic. So in a series of interviews with some microtransit drivers, Charlene Hall, who is a Cecil Transit driver with Compass, shared her experience, including mentioning some, minor challenges with some of the routing technology, not quite aligning with the geography of Cecil County, as the locals know it. Have Compass drivers reported any additional feedback after, using these on-demand technologies for a little while?
So interesting enough, I think that this on-demand technology is just rapidly improving. And we went from Route Match to Uber, who provided the software during the IMI launch because Uber had acquired Route Match. But since then, Uber no longer supports this. They were a wonderful partner. I should have mentioned them sooner, but they really supported us as long as it took us to find another vendor to support Compass. And they really went above and beyond in that. But so now we're using VIA software. And honestly, it's pretty seamless. I mean, the problems that we have are just very minor problems. Things like the system doesn't always recognize exactly where an individual is standing. So once a driver goes to pick up an individual, if it doesn't trigger that I guess geozone, they may have to pick the person up and then drive around the block to try to clear that trip as being picked up. But I mean, in general, just very minor issues. All the drivers state that it's really easy to use, it's self-explanatory, and it really doesn't require much interaction from our dispatching staff at all.
Great. And continuing with the driver feedback, Charlene also mentioned some of the community impacts that she observed while driving and interacting with passengers. Have you received any feedback from drivers or passengers, I guess, relating to Compass and its community impacts?
Sure. Just recently, I was talking to 2 different drivers, and the one driver stated that every day riders thank her for the service. They state that they wouldn't be able to stay successful in their sobriety, or they wouldn't be able to work without the program. And the fact that we're able to just charge $2 fare for service really goes a long way in helping the individuals out. And additionally, we had an individual tell one of the drivers that going to their support group, being able to go to the support group so often really does make a big difference in their recovery.
That's great to hear. So can you talk a little bit about some barriers? What barriers does Compass have to overcome, and what solutions have you tried?
One of the biggest barriers we have is really pushing the program and to its limits without breaking it, right? So just trying to learn how much can we really do with the amount of vehicles that we have on the road and the number of drivers that we have. And because it's such a closed eligibility program, it's really hard to expand enough to get there. So we have partnered with other agencies besides recovery houses. We have some community support programs that we're now supporting. And just trying to figure out that balance, because if we opened it up to the general public, we'd break it really quickly. And that's not what we want to do. We just want to be able to determine what exactly can we do with X amount of drivers and still have a reliable service. I mean, still today, we really do have a 0% unfulfilled trip rate. And how we define that is an individual would have to request a ride for about an hour. We ask people to plan about an hour ahead of time to get to where they're going. And if within that hour they still don't get their trip after requesting it several times, then we consider that an unfulfilled trip. And that never happens. So we're still with it. And that's a good thing, right? We set a metric for that number to be 10% or under, knowing that sometimes that may be possible or it may be unavoidable to not have some unfulfilled trips. But we really haven't pushed this program that far yet. So still trying to do that. And I think these additional grant funds will help us be able to do that.
So what lessons have you learned throughout this whole process? What advice, would you give to other communities potentially looking to start a similar program?
Well, I think my biggest lesson for individuals that are doing microtransit is to be realistic in what you want to do with the program. Set really good performance metrics, state, specifically how long you want somebody to have to wait for a ride from the time that they request it. Be very specific in how long a trips that you're looking to complete, and measure that on a regular basis and adjust the program quickly when you see an issue, so that you're not in a situation where people quit using it. Because if they, my opinion is, if they start to use the service and they're not getting their trips to work, and they're going to get fired if they don't get that trip. So they're not going to use it anymore. They're going to find a more reliable service. So in order to build that ridership, which we have built our ridership considerably, it was 50 passengers, unique passengers when we first started, and we're up to 194 that are using our service today. And again, we still haven't broken it. So it really is an efficient mode of service. The other thing is to start small and grow from there. Make sure you can do what you say you're going to do in a small area, and then slowly grow either your scope or your zone to the point of breaking, and then shrink it back. We had to do that once in the beginning of the program. We have a veterans hospital in Cecil County known as Perry Point, and it was at the very edge of the zone. And what happened is individuals would be able to book a ride to Perry Point, but then there weren't vehicles in the area to get them back. So instead of leaving people stranded, we shrunk the zone so that it was where we could handle it. So just being willing to make those changes and those adjustments quickly makes a big difference. Make sure you keep your riders in mind. Keep them first and foremost in the process. I'm trying to think what else I got. So funding sustainability is the biggest challenge. And I had already mentioned all the grants that we're applying for, and even the disappointing, sorry, you don't fit our program, can't stop you. You have to keep going, right? You just have to keep trying. Sooner or later, you will find a program that will fund you. And every grant application that we do gets a little bit better than the one before. So I would just encourage people not to give up. If you have an idea, create the program, find the funding later, but just continue to go after that money. If you find enough to do a pilot, do a pilot. If your community is very supportive of it, hopefully you'll be able to find other sources of funding to sustain it later on.
Fantastic. And then finally, what are the plans for Compass in the future?
Well, this is the area I could talk all day. So, but I'll try to be brief. I mean, really, this program is so adaptable that it can be transferred to any case use. It's so wherever the funding comes from, we can design the program or a new program to meet those needs. Ideally, I'd like to see Compass as a first or last mile, but in a rural community like ours, I would say even 5 miles, right? To be able to get people to fixed routes so that they can continue their trip elsewhere. I would like to see Compass expanded to serve the non-emergency medical transportation industry. There's so many unmet needs out there, whether it's seniors trying to get to their medical appointments, and just making a better system for customers, I think, rather than the dial a ride programs that you have to plan ahead for, and they may get filled. So just trying to use it for that from that perspective. I also would like to see it used for gauging fixed route expansion. So if there's an area that may need fixed route, instead of putting a bus on, creating a schedule that may last 12, 13 hours a day, you may only get a few trips, and the public sees an empty bus, trying a microtransit program or a Compass program first to see if the need is really there. And once you grow beyond the capabilities of that microtransit, it's easier to support that fixed route. We also have a couple partnerships in the works to support a federally funded medical center, or medical center is the right word, but it's known as West Cecil Health Center. They're located in 2 locations in Cecil County and 1 in neighboring Hartford County. And they just really do provide access to medical care that otherwise would not be available to individuals in the rural community. So trying to partner with them to get some grants to explore a service directly related to those trips, as well as, working with new employers or large employers that come in that really want a more robust service for their employees. And, again, if there's something they're willing to fund, it's something that we're able to kind of customize to meet their needs.
Well, great. And thank you so much again for sharing your story and sharing the story of Compass with us.
You're very welcome. Thank you so much for giving us this opportunity. I appreciate it.